Hi, my name is Diantha and this is my presentation on superbugs. First thing that you need to know about superbugs are what they are. And some people hear the word superbugs, they might have all sorts of visions in their head, but you need to know that when I'm talking about what superbugs are, I'm not talking about giant bugs. I'm not talking about superhero bugs. I'm talking about this kind of bug. And that's basically bacteria. Superbug is actually the slang term for bacteria that have become resistant to antibiotics. And one of the most common kind is known as MRSA, or sometimes a staph infection. And it's common in hospitals, prisons, nursing homes, places where patients generally have open wounds and can easily pass along infections to each other. One of the problems with these kinds of infections is that unfortunately they actually kill quite a few people. 103,000 people die from these infections each year, and currently these infections are the fourth leading cause of death in the United States. And even if you don't die from it, unfortunately the CDC has reported that there's about 2.1 million people, patients in hospitals especially, that are infected by these staph infections each year. And so how does this happen? Well, one thing we have to understand is that bacteria can evolve very quickly. For example, penicillin, it was first used to kill the strep bacteria in 1939, but only 2 years later, in 1941, there were already strep bacteria that were resistant to it. So part of the problem is that bacteria just evolve really quickly. But there are other factors too. Part of the problem with superbugs these days has to do with the way that we're treating animals, particularly livestock and chicken, with antibiotics. It's also the way that we're doing research on drugs. It's the way that we're prescribing medicines, and it's also in the way that we're conducting hospital care. And today in this presentation, I'm going to focus on the last two, the way that we're giving out prescriptions and the way that we're conducting hospital care. So you might be asking yourself, well, how's the medical field connected to these factors? And it's pretty clear when you talk about two major things. And the first one is prescription abuse. One of the major problems and reasons why superbugs are able to evolve is because people don't finish their antibiotics. And as we all know from Kelly Clarkson, what doesn't kill you makes you stronger. And if people don't kill off the bacteria through those antibiotics, those bacteria do get stronger. Another problem is that doctors are often overprescribing antibiotics. People want a quick fix, and so doctors feel pressured to give that to them through antibiotics instead of other remedies. The other major issue, besides prescriptions, is cleanliness. Hand washing in hospitals is really important, but because the staff are overworked and often work long, hard hours, they're able to just overlook it, or they don't have time to do it, or it's just hard to get to the sink in between meeting each patient. Also, the cleaning staff are often really undervalued and undertrained. Many hospitals are actually cutting their cleaning staff to try to save money, or they're cutting the infection tracking personnel to try to save money. And unfortunately, while this does cut costs, it causes huge problems with infection. So what do we do? What can be done to stop these superbugs, and how can medical staff help? Well, one of the major things that we need to do is make sure that we do clean up hospitals. We need to make sure that the cleaning staff is trained, and also that we have enough of them. Also, we can help doctors and nurses to be effective with their busy schedules by giving them checklists so they can quickly identify, remember if they've washed their hands or not, and also quickly identify infections with their patients. The other big thing is that doctors and medical staff can help us to educate patients so that they know that use as directed isn't just a suggestion, that they need to use their antibiotics completely and take them as directed. Also, they need to know that there are alternative remedies and there are good reasons for using them, other than, the convenience of just taking pills might seem great, but these other alternative remedies will actually help people to stay healthier in the long run. So overall, if we're going to fight superbugs, we need super medical staff. There are many reasons why we have superbugs, but if we can work on the way that we clean up hospitals and medical treatment centers, and if we can make sure that doctors and other medical staff are helping patients understand why they need to take antibiotics and what other options they have, then we have a much better chance of solving some of the major problems that we have. Thank you so much for listening.